More than 25 years ago, Professor Twardowski experienced that repeated cannulation of the same puncture sites was a successful puncture technique in patients with an arteriovenous fistula. This method of constant site puncturing was later called the buttonhole technique. Here, you can clearly observe that this patient, who was dialyzed for several years, has only two puncture sites, one arterial and one venous. Some dialysis facilities throughout the world have been using this technique successfully for many years and are convinced that the buttonhole techniques offer several advantages compared to other cannulation techniques. The goal of this video is to familiarize the practitioner with the technique, to promote it, and to show the different steps for a successful result. First, let's analyze how to perform this technique. 4 consecutive steps must be followed. The first step consists of carefully choosing both the arterial and venous cannulation sites. The procedure starts by an evaluation of the fistula. We have to check, through observation, for evidence of inflammation surrounding the fistula, edema or swelling, drainage, pain, and signs of aneurysm. Through palpation, we have to check blood flow through the access and use a stethoscope to identify the direction of flow. We subsequently will look for healthy and, if possible, straight areas which are easy to cannulate. We should also consider the possibility for the patient to self-cannulate. There should be a minimum distance of 3 inches between both cannulation sites. However, this is not possible in all cases, and a shorter distance can be accepted if the fistula has an adequate blood flow so that recirculation can be avoided. It is mandatory that the cannulation site selection and the next step, the first cannulation, are performed by an experienced practitioner, as the success of the technique will greatly depend on it. The second step of the technique consists of the very first puncture. Start by thoroughly disinfecting the cannulation site. Apply a tourniquet and palpate the vessel to be cannulated. The cannulation is performed with a normal sharp fistula needle at an angle of at least 25 degrees.